Hey there, so I'm presenting on fiscally responsible solutions without compromising care, specifically ortho solutions. My proposition is that our organization add orthopedic services back to its full-time surgical package. It's requested that both a full-time orthopedic surgeon and a nurse practitioner and/or physician's assistant be posted and hired. Why? Because currently, per articles that I've researched, there's an increased prevalence of skeletal disorders due to our rapidly aging population. That's the prime factor for driving the demand for arthroscopic and joint procedures. It's estimated that there's going to be a 6% growth rate of arthroscopies in the marketplace over the next several years. Arthroscopies are also the most common orthopedic procedure done in the United States for degenerative knee disease. Specifically to our patient population, American servicemen and women are getting new hips and knees at an increasing rate. Over an 11-year surveillance period, researchers have discovered that service members in their 30s and early 40s were having joint replacements and procedures done more often. This allows them to correct their joint disorders and have a longer longevity in their field of work. So instead of taking early retirements and things like that, they're able to stay in their position a lot longer. Why does this matter to the VA? Because we are at Munson no longer sees patients, and therefore they're no longer doing orthopedic procedures at all. The VA can capture this workload and help our servicemen and women who aren't veterans but are still active duty, leading us to be able to bill TRICARE and have better RVUs. Adding our orthopedic services will increase our case volume, increase our OR suite utilization, reduce our non-productive staffing hours, increase funding justification for replacing of aging equipment, greater return on investment, and help address and reduce the hundreds of patients currently waiting on ortho consults and/or being funneled into the VA Choice program, which is a program that allows veterans to go to the community if they have to wait longer to be seen than 30 days and/or their travel distance is too far. What we have and what we need. Why is this an important expenditure? We currently have a full OR staff. We're currently underutilized in operating space. We have a fully staffed, underutilized clinic support staff, unused clinic space, necessary arthroscopic equipment for all surgical procedures in the ortho realm, and we already have existing contracts with vendors such as Arthrex and Stryker. What we need is a full-time orthopedic surgeon and a mid-level for support. We currently have those positions, but they are only part-time, leaving our OR suites unused half of the time. Our VASCOEP data shows that we have around 35% of our patient population waiting on orthopedic services or consults to be seen. 30% of our patient population in this VISN is awaiting orthopedic procedures with a backlog of around 3 months, and that's only getting longer. We here at this facility can have patients consulted and seen in the procedure done within a matter of weeks, versus consulting them to outside providers, which can have patients waiting months to have a procedure completed. If we added a full-time orthopedic surgeon instead of contracting our part-time, we would be able to drop these numbers dramatically. We currently also save money by doing them in-house versus sending them out to choice programs and other private organizations. The cost or the disadvantage to our organization is the upfront cost of hiring providers. However, I point out that we'll still be saving money as we currently contract one orthopedic provider or choice out orthopedic services and therefore pay high premiums for physician services on a per case basis. There may be a slight delay if the current providers don't apply or don't get chosen for the position in turnover and growing pains. So that just means that the providers that we're currently paying on contract, are fairly young and they might not be looking for a stable kind of retirement job that kind of you end up with at the VA. Our average salary for our contract providers is $250,000 a year, and that's for 2 days a week. And roughly we pay our mid-level $150,000 also to support that surgeon 2 days a week. When we could get a surgeon for $250,000 who will work 5 days a week and a mid-level for around 110, depending on the boarding process. So by spending the same amount of money, we could have a higher functioning, more profitable ortho services. This is my SWOT chart. So some of our strengths are return on investment, ample experience and qualified staff, infrastructure is already in place. We would be able to keep consistency. We're the only VA within 40 miles to be able to perform ortho procedures. We meet the immediate and long-term needs of our veterans, our patients, and this would also support our mission, vision, and values. The weaknesses is that we need competitive salary per industry standards for the positions that we're trying to request. We need applicants and interest, which typically we end up finding older physicians who are looking more towards retirement instead of the young guys straight out of school. It's hard to recruit full-time staff because often our space is antiquated and a little outdated, and some ortho providers aren't keen on that. Long time frames to post, pick, interview, credential, and onboard staff and providers is a weakness, as well as our primary care and CBOCs having limited information on our capabilities. The opportunities that we have is that private hospitals are costly for the VA and patients as well as taxpayers. So this is a time for us and a way that we can kind of create our place in savings. And we're somewhat a niche specialized for this area because we have an overwhelming need for this service on a full-time basis. We would increase our RVUs, staff production, OR room utilization, fast clip cases to support and maintain standard complexity level, ease and timeliness of patient access to care. We would also help justify the budget request for funding in future years. And the opportunity to get in on this is important because, like I said, demand is trending up over the next 5 years. Threats are losing the contract providers without having designated providers in place. That's an unlikely situation because those contract providers get paid per case and therefore would not have much justification for leaving until they were replaced. Contract providers not wanting to come or getting posted positions. Another threat would be temporary delays in care and possible delays because of succession, getting those new providers in, getting them trained on our system, and getting them working. Also, terminating orthopedic services altogether. Having a full-time orthopedic clinic will dramatically improve the well-being of our patients, organization, and staff. We have all the potential to generate at least double our surgical RVUs with having providers here 5 days a week versus only 2 days with the same financial burden. Replacing contract ortho services is a necessity to providing the best services and being chosen first in patient care. Fiscally, it's irresponsible to provide full-time support to specialties that are unavailable most of the time. It's a major drain of resources like staff, OR time, and budget. Thank you for your time.